Good morning, everybody. So the 24 hours to 8 p.m, we had nearly 40,000 people come forward to get tested, just under 40,000. But as Dr. Chant has said, we really need those high rates of testing to be able to have a level of confidence that we're not missing any undetected chains of community transmission. So please know, if you have the mildest of symptoms, get tested and stay home until you get health advice. That is so critical. Overnight, New South Wales had 38 cases of community transmission. 18 of those were people who had been in isolation for the entire time. 9 had been in isolation for part of the time. And unfortunately, 11, we understand, had been infectious for a number of days in the community. Now, those numbers are too high. We need to get those numbers down. And I want to say in the most strongest possible terms, please avoid contacts with other households. Please avoid visiting family and friends because you're not allowed to. When we talk about providing care or compassion, we're talking about one person visiting someone who might be isolated, dropping off goods or essential services or providing essential services. We're not talking about visiting extended family members. We're not talking about visiting friends. This is, the data shows in the last few days, that is how the virus is spreading. And the saddest message out of all of that, is that people with the virus are passing it on to those they love most. We're seeing the greatest number of people get the virus in the last few days being household contacts. Parents, children getting it, grandparents, extended family members. So please know the rules are there for all of us to respect those rules. And I appreciate how difficult it is. And I want to express that my comments go to everybody who's under stay-at-home orders. Just because your suburb or your local government area doesn't have any cases of the virus doesn't mean that you won't get that, doesn't mean that you won't potentially be spreading the virus. So the two strongest messages we really need to get across today is, firstly, please stop visiting people indoors outside your family, your household. Your immediate family means those you live with. It doesn't mean extended family or friends, and that goes across the board, across any person who's in lockdown. Providing care means one person goes to support someone who might be in isolation or who might be receiving Meals on Wheels or who might need goods or services. And of course there are exceptions with that, with disability care and the like. But in the main, if you need to provide support to a loved one who's isolated and can't take care of themselves, it does not mean taking your whole family. It doesn't mean taking other people along with you. We need to be stern about this. We just need less movement to get those number of exposures down. The numbers will bounce around, but we need to see the number of people exposed in the community down. So that the first strongest message is do not visit people outside your household in indoor settings. And secondly, please make sure that if you have the mildest of symptoms, you're not going out of your house to a workplace or to visit a loved one who needs care or any other reason. If you have the mildest of symptoms, the only reason you should be leaving your home is to get a COVID test. And we can't stress that enough. The two biggest areas where people are spreading the virus is through household contacts of people close to them and people who are undertaking activity with symptoms. Now, these are the two greatest causes for where we see the rates of community transmission at the moment. We don't want to prolong the lockdown. We don't want to see Sydney or New South Wales go in and out of lockdown until we have the vast majority of our population vaccinated. So it's really up to us, to all of us, to step up, as difficult as it is. And you'd expect me to be very direct and frank on what we need to focus on. And I ask everybody who's under the stay-at-home orders to really respect the rules that are in place. They're there for a reason. I now ask Dr. Chant to provide her health update. Deputy Commissioner Warboys will of course provide an update on compliance, and police are focusing their efforts across the board, but in particular we'll be focusing on those areas which we've identified. And then of course we'll take your questions. Thank you.
New South Wales recorded 38 locally acquired cases of COVID in the 24 hours to 8 p.m. last night. 26 were locally acquired and are linked to known case or clusters, and of these 13 are close contacts and 13 household contacts of previously confirmed cases. Again, indicating and demonstrating what the Premier has said. When we find a case in a family, we find that everyone in that household has the disease. Clearly the household sizes, you go in and find one case and there might be 5 other people in the household, they're infected. It is critical that we get to those households as early as possible. So again, make sure that even now we're asking if anyone you have symptoms, even considering get all your household tested at the same time to actually reduce that time where we're actually getting those sequential notifications. Of today's 38 cases, 17 were in isolation throughout their infectious period and 9 were for isolation for part of their infectious period, and 11 cases were infectious in the community, and 1 is under investigation. What we are now seeing is cases pop up in a lot in other overnight, some cases that are popping up in other geographical areas. So I think it's really important that every time we leave our home, we need to consider that we may come into contact with someone who has COVID. It is therefore so critical that we minimise our movements. In terms of our caring responsibilities, that should be one person that has to care, and it's not a discretionary visit. It's not because the person wants to see you. It's because you absolutely need to be there to either deliver food, to check something, to fix something, to feed them. We're not talking about discretionary visits. Also, it's critical that we do not have this as, okay, I usually have my extended family. I see them as my family. And what we're asking people to do is redefine the sense of family. The family unit is the household, people you live directly with. Also, it's important to note that we've had 40 COVID patients admitted to hospital. There are 11 people in ICU, 3 of whom are ventilated. 17 people admitted to hospital at the moment with COVID are under the age of 55, and of those 10 are under the age of 35. Of the 11 people in ICU, 1 is in their 30s, 1 is in their 50s, 5 are in their 60s, and 4 are in their 70s. I think it's incredibly important to again emphasise, yes, the orders permit certain activities, but what we're asking the community to do is please apply common sense. If you are leaving your home, ask yourself, do you really need to leave your home? If you're going shopping, think about what you absolutely need. Do the list, get in and out. This is not the time for browsing. This is not the time for what I might need. We're asking the community to only shop for those essential goods. Now, the reason we haven't defined essential is because clearly people may need blankets, rugs, school shoes. These are the sorts of things that are defined essential. And I've got confidence that the New South Wales community actually understands what we mean by essential. So no browsing, no, I might need this in a few weeks' time. And whenever you can, shop online. I understand the supermarkets have got also very rapid processes for click and collect, but they've also got good processes in place, so some real tips about making a list before you go, get in and out. Also, when you are moving about, wear your mask correctly over your nose and mouth, and put it on well ahead of when you're entering the premises to make sure that you're keeping yourself safe and others. In terms of the areas that we're concerned about, we obviously need everyone to be concerned. So when I read out these suburbs, it doesn't mean that if you're in a different suburb, you don't have to be worried. But what we're trying to highlight is areas where we're particularly calling out for testing. And we've done this traditionally in terms of saying areas of concern. So the Fairfield local government area, places like Bosley Park, Smithfield, Fairfield, Glenfield, West Hoxton Park, Bass Hill, Greenacre, St John's Park, Bonnyrigg, Bankstown, Roselands, they're examples of areas where we know that we're seeing cases, but the cases will change. And that is why it's critical that everyone sees themselves at risk. Again, I can't emphasise enough that the employers and businesses often have very understanding if anyone has symptoms and cannot come to work. I just would again urge everyone to not attend work if you've got symptoms. In this context, I'm sure that all employers and businesses will be very understanding of your need to stay home and get a test. That is the best way you can protect the community. In terms of young people, I understand that young people, my messaging around young people is that you have a great role to play. We know that you often support others with caring functions, and again, to listen to those messages to make sure that they are essential caring functions. We also want young people to reach out through their social networks. They can do that quicker than our contact tracers can. Make sure that they're really encouraging high rates of testing along their social groups. And they can play a part in reinforcing these messages. And we know that young people care dearly about their loved ones and wouldn't want to put them at risk. So if Granny says that they want to have a visit, please do it on the phone or FaceTime, and please explain to others why it's so important that we don't have that connectivity across households at this time. So use digital and phone options. As I said, in summary, one person should be making the care and compassionate visits, and if it's possible, keep it to the one person. All of these little steps reduce the risk of contact, and COVID is spread through human contact, through proximity, particularly in indoor environments. So if we can keep people out of those settings, we can stop the spread.
Thank you, Dr. Chan. Minister, Premier, good morning. We want to make it really clear that the connectivity between Greater Sydney and country around information being shared amongst police is as good as it ever has been around this COVID environment. In and around the transport hubs, such as Central Station, where trains and buses leave from, our Police Transport Command are there on a daily basis. They are sharing information with people in country New South Wales, whether that's at Tamworth, whether that's at Dubbo, whether that's down at Wagga, about buses and trains that are leaving. And often it's the case that country New South Wales, that there are police in those police districts that are meeting those services and again checking that people are complying with public health orders and not leaving Greater Sydney without that reasonable excuse. I want to also highlight an incident that occurred yesterday at a Bunnings store where a man, 51 years old, was chastised by another gentleman about a face mask issue. The gentleman that was doing the chastising then decided to spit at that man. Police inquiries have failed to reveal the identity of that person. They've looked at CCTV, they've asked a number of questions. If anyone has any information in relation to that person, we'd ask them to ring Crime Stoppers on 1800 333 000. That behaviour is just disgusting. It's not called for. These are difficult times. If people have an issue that they can't resolve with some cordial communication between two people in and around these retail settings, they should ring the police. They should provide that information and police will follow it up. There is no room to act in what is criminal behaviour and spit at a person because you don't like the answer that you got in terms of a face mask issue. I'd also like to highlight an incident where a gentleman travelled out of Greater Sydney to the Mudgee area where police spoke to that gentleman, and his reason for travelling out was to meet a person that he had met on social media. These times are not the time. They are not the time to move out of Greater Sydney for that sort of reason. Police deemed that not to be a reasonable excuse. He was issued with an infringement notice and sent back to Greater Sydney. In terms of South West Sydney, police have been in and around those local government areas. Very pleasing with the interactions that they've had with people in those areas, people in the main complying with the public health orders and willing to engage police. We are going to continue with our efforts in terms of elders in that community with mayors and general managers, with business leaders, to make sure that the message is clear and that people understand that New South Wales Police want to work with these communities in terms of compliance. We're going to get stronger teams of our Multicultural Liaison Office and look towards police officers from diverse backgrounds that can work with those teams in those areas so we can deliver a very clear message. And that message is we simply want you to understand the health orders, understand how the health orders can protect you, your family, your friends, and indeed make that contribution to the state and the pandemic. Thank you.
Premier John Barilaro this morning has said that if we can't stop community transmission, we might need a plan B. That was after the Health Minister said that if people don't do what Terry Chant's asking, we might need to accept or reach a stage where we need to accept that the virus will be living in the community. What is plan B, and at what point do we need to accept the virus might be living in the community? What would that look like? How many cases would you be comfortable with in the community?
I think what is apparent is that until, and this has been demonstrated by every other place on the world, and we can't pretend we're different in New South Wales or Australia, is that you can't live with the Delta variant unless you have a certain proportion of your population vaccinated. That's the bottom line. If you could have done that, New South Wales would have found a way, and in previous outbreaks that we've had, we've managed not to go into lockdown because we've had the resources, the capacity and the transmissibility rates to deal with it. But this new variant is a game changer, and there isn't anywhere on the planet that's managed to live with this variant of the Delta virus without having a proportion of their population vaccinated. And that is why it is so important for us to make sure that people follow the health advice that we've been giving on a daily basis. And this is why New South Wales, from day one, has had a sense of urgency about the vaccination and getting our population vaccinated. Can I please stress that if you're over 60, you don't have a GP, ring our New South Wales Health Direct and make sure you book yourself in to get the vaccination. Everybody over 60 has access to the AstraZeneca, and we know we've got about 2 million people in that cohort in New South Wales. And now is such an important time for you to get vaccinated. Equally, if you've had the first jab of AstraZeneca, no matter how old you are, please go and get your second jab. And if you're younger than 60 and want the AstraZeneca, please go to your GP and get the advice. This is really important. I can't stress enough, and New South Wales has had this sense of urgency from the beginning. I remember being criticised when we set up our mass vaccination hubs. I remember being told that states don't have a role to play in the vaccination rollout. But we know how critical it is to increase that. We know how important it is to fight the Delta variant, in part by higher vaccination rates. But it would also be unrealistic to suggest that we are different from anywhere else in the world. You can't live reasonably with the Delta variant unless you have a certain proportion of the population vaccinated.
Does that mean we need to?
Sorry.
Does that mean that we won't necessarily come out of lockdown on Friday, given that we've now seen the highest single daily number?
Oh, look, I think what is important is all the experts have said that if every single person does the right thing, that we can get to where we need to go at the end of the 3-week period. But that is a big ask, because we know that, unfortunately, unintentionally at times, people don't do the right thing. So it's really important for all of us have an equal responsibility. It doesn't matter where we live, in Greater Sydney or in the regions, it doesn't matter where we live or what our circumstances, each and every one of us has a role to play. Often even it might mean explaining to friends and family members what they can and can't do if they try and interact with you. It's really important for all of us to stay the course and follow the health advice to give us the best chance of getting out of this lockdown in a timely way. But for us to think that we can control a very contagious variant without having a certain proportion of the population vaccinated would be an unrealistic assumption. And that is why it's really important for all of us to do the right thing. New South Wales has always been bold and courageous in terms of our attitude to how we deal with COVID-19, but we have to accept that Delta is very different to anything we have seen before, and we only have about 9% of our population vaccinated. So we have to be very mindful of that, and our ability to come out of the lockdown in a timely way is dependent on all of us sticking together and doing the right thing. And I have to say that the overwhelming majority of our citizens have been outstanding. But we also appreciate how difficult it is for some who are especially vulnerable to stick to the rules. And we just say to everybody, no matter where you live or what your circumstance, please stick to the rules. That is our best chance of coming out of this in a timely way. But it would be...
Given the Federal Treasury has rejected your request for more job care, what will your government do to support casual workers and staff who have been stood down as a result of your lockdown?
Well, can I confirm that the Prime Minister and I have had very constructive conversations yesterday and this morning, and we are leaving the door open to receiving additional support in that regard from the Commonwealth. So I want to stress that the conversations we've had are ongoing and very constructive, and we will have something to say about that moving forward. But I wouldn't assume anything at this stage in terms of New South Wales not receiving supported requests. And I will just say that as soon as we have something to announce in that regard, we will. But I do want to thank the Prime Minister for giving me his time in listening to the New South Wales position. And the four of us, both myself, New South Wales Treasurer Perrottet, the Prime Minister and the Treasurer, had a very constructive discussion yesterday. That's been followed up with discussions with the Prime Minister and myself today, and that will continue throughout the day. But please know that all options are on the table as far as we're concerned, and I have to say as far as the Commonwealth is concerned as well, because what I really appreciate and thank the Commonwealth for acknowledging is that the success of our nation depends on the success of New South Wales. We have borne the burden during COVID. We've kept this virus at bay for 18 months, and we have contributed to Australia doing as well as it has. But moving forward, we also do rely on the Commonwealth and the state working together to get us through this very difficult challenge. And I just want to thank the Prime Minister for acknowledging that and for being open to listening to the case that we put to him.
Your tone with respect has changed quite dramatically in the past 2 days, because the reasoning for the extension was that we want to end on the 16th to avoid further lockdown. Is that 16th date now in significant jeopardy?
Oh, look, we're still aiming for that, don't get me wrong, but we also know that that's dependent on all of us doing the right thing. There's no date that is our aim, and experts have told us it's achievable. If it wasn't achievable, we wouldn't have provided those details to the community. But that's assuming everybody does the right thing, and that's assuming we work together to make sure we stop the spread. And as Dr. Chant, myself, the Minister have said, we just need people moving around because they feel like it. Please stop that. Only go shopping when you have to. Don't visit people in homes unless you are the same person providing care or support to that same person. We just need people to stop interacting for this lockdown to work. And I don't just mean in one part of Sydney. I mean these comments for everybody in stay-at-home areas. That's why we're following the health advice in relation to what we define as Greater Sydney, those areas that have been required to stay at home unless they have the 4 reasons. I know it's really, really hard, but our strategy is that we want this to be the one and only lockdown between now and when the majority of our population is vaccinated. And on that point, I want to stress that some weeks ago I said our aim was to have 10 million jabs. That's about 80% of the adult population, but it's only about 62% of the New South Wales population. So I want to be clear that we put that target out there to say we want 10 million jabs so we can get back to normal, but that only represents about 62% of the population. And we've put that down there for a while, but obviously we'll work with National Cabinet in relation to that. But we need to be real. New South Wales does want to open up. New South Wales wants to engage with the rest of the world. New South Wales wants to go back to normal life, but that depends on really getting our population a substantial proportion of our population vaccinated so that we can make sure that, that the hospitalisation rate and regrettably, in future times, the mortality rate is not beyond what the community expects. And that is really important to remember. And it's really important, and that's why from day one, we have had a sense of urgency about the vaccination. But I also want to stress that there isn't a single jurisdiction on the planet that's managed to live with this variant without having a significant proportion vaccinated.
Given those comments that we can't live with Delta.
Ashley has another question.
Just in terms of the message getting out in southwestern Sydney into multicultural communities, there has been suggestion that there's been concern with translations not being accurate. How confident are you that the message is accurate, and are you doing any work in that space?
Yeah, can I firstly thank all the community leaders that engaged with us yesterday? Between Minister Hazzard and myself, whether it's all the local mayors, local MPs, religious leaders, all faith leaders, community leaders, we have had great consultation, and that is, and we were obviously going to continue that. We're also following up today with all the multicultural channels to make sure the message gets out. But that goes for across Greater Sydney. But of course, in particular communities, we know we need targeted messaging, and we will do that. But that goes across the board. And I just really want to thank everybody for their engagement. The health experts have relied on that consultation to know what people are doing on the ground and what we're observing people are doing to respond in the way that we have. And I also want to thank a number of people who've put aside their political differences to really come forward and give us that great advice. And we will be relying on everybody to help us get the message out in all different forms. We've had outstanding engagement with all communities from the get-go, but obviously that will be further enhanced and continue in following days.
Given your comment that we can't...
Please, yep.
You're asking a lot of young people. It's young people cancelling their weddings, losing their jobs, their businesses are going down the drain, suicide rates are going up. But young people cannot get vaccinated. The elderly can, and young people are being asked to make all these sacrifices to protect older Australians. Do you see a problem with the equation that young people can't get vaccinated?
Can I say at the outset, we've always argued for extra supply of vaccinations. It's the one thing the New South Wales government can't control. And we've had a sense of urgency in New South Wales about the vaccine. And I especially want to thank young people, as does Dr. Chant, and we had a discussion about this before we came out here this morning. Young people, as well as many others in the community, are doing it tough. And we want to make sure not only that they're supported, but also that we appreciate the sacrifices people are making. We also appreciate that young people don't want to have the guilt of unintentionally passing on the virus to their parents, to their grandparents, to their loved ones. And we appreciate the sacrifices made by practically every citizen. All of us, to some extent, are going through a difficult time at the moment. It doesn't matter what walk of life you're from, what your background or your age. It's a very challenging time. And please know the New South Wales Government is giving thought to every age group, every demographic. But if people are in need, if people do have concerns, please know you can reach out for that support and assistance, because it's there. And I don't want, even if you live alone or you're having these struggles, we don't want anyone to feel not supported. There are various opportunities for help, and we just ask people to reach out. But of course, we as loved ones can make sure we're keeping in touch with our loved ones through virtual means, through phone contact, through FaceTime. There's opportunities for all of us to reach out to people that we know live on their own, or people that we know are struggling, or people that we know are perhaps going through mental health anguish, in addition to the professional support available. And that is really, really important. And I also have to accept and acknowledge that this difficult time New South Wales is going through is after 18 months of living with COVID. It's not something, unfortunately, that we're having to go through earlier on. It's something that the community, many in the community, have been through the stresses of running a business, or paying household bills, or educating children, or trying to get their foot into the career ladder. which in particular affects young people. So we're at a stage of dealing with the pandemic where all of us are feeling somewhat fatigued by it, which is why we need to have the right settings in place in New South Wales to make sure we all stick together and we all do the right thing.
Given your comment,
Mark McGowan has said that if the state does not crush and kill the virus and lets the Delta variant run rampant, he will consider a permanent hard border with New South Wales. What's your response to that?
Oh, at least it's consistent.
Premier, given your comments about that...
Oh, sorry, who hasn't asked a question? Yeah.
What would you say to people who feel that the southwestern suburbs are perhaps being unfairly singled out and maybe even blamed for an outbreak that started in the eastern suburbs?
Oh, look, that's never the intention of the New South Wales government, quite the contrary. We're here to help people, to make sure people know what the risk is, but I don't think I'd be doing my job properly if I didn't call out what the health advice said. It's really important for me to say it like it is. And please know that when we say it like it is, we don't mean to cause offence. We just want to get information out. Because if we don't say it like it is, people won't think about their own actions and behaviours. And I think the people of this state would expect me to be honest and direct, especially at a time like this. I'm not going to beat around the bush. I need to be direct, and I don't mean to cause offence to anybody. Quite the opposite. Our words come out of care and compassion. Our words come out of wanting all of us to come out of this as quickly as possible, as safely as possible, and as intact as possible. And that's why it's my responsibility to be direct. And if I've offended anybody, I apologise. It's not intentional, but it's really, really important to be honest, direct, to get the message out so that people do sit up and notice. And most of the time, it's just because people aren't across the rules or don't know or don't understand. And that's why it's really important to highlight the risks of what your behaviour might mean, because we always think it must be someone else it happens to. We never think it's going to happen to us. We never think we're the ones that are going to infect our entire household. But that's what we're seeing. Imagine going home, no matter what your age is, and giving the virus to your husband or wife, your partner, to all of your children. And then if you've happened to go and visit your cousin, to all of that family. And that's what we're seeing, unfortunately. We're seeing households give it to their loved ones, give it to each other. And we have to stop that. It is just, relatively speaking, think about the time you have to spend together beyond the lockdown. It is for 10 more days, or for a week and a bit more, we're saying please make that sacrifice to give ourselves the best chance of getting back to normal as soon as we can.
Given your comments,
Do you feel like we're losing? Do you feel like we're losing the battle? This is the highest number yet, and the feeling in the community is bordering on mutiny.
Look, I'm always impressed about how the New South Wales community has actually rallied. If you look at the positive signs about the testing rates that have been sustained, the fact that we have seen high testing in the areas we've called out for. Clearly what we've seen is that there has been transmission in a lot of households in a number of different settings, and that has led to us to identify cases. What we really have to do is assess over the next 24 to 48 hours, have we stopped the expansion of that? We know this virus can spread quickly and within households in indoor environments very, very quickly. So really today is an assessment. Will we see numbers? We'll be looking at whether we're seeing case numbers decline as we've actually identified all the people infected, put those contacts in isolation. And if those cases are arising in those people in isolation and they're effectively isolating, they pose no risk to the community. But what I'm highlighting overnight is we've also seen cases pop up everywhere. So my message is, while we've highlighted Fairfield and those local government area and some of those suburbs, do not think you are immune if you are in other parts of Greater Sydney. Please don't think that it's only the suburbs I'm telling you about. I'm telling you about emerging trends or emerging issues to highlight that. But everyone has a part to play in following the key messages, which is stay at home and keep to yourselves. Please do not go and visit others. Obviously, if you've got care and compassion, figure out the one person that's going to do it. And also, as I've said, when you're going to visit, keep your visits short. Don't go at all if you've got the most minimum of symptoms. Please get tested early so that when we get to you, you haven't been in the community infectious for a number of days. We do just also, I don't want this to cast aspersions. Many people are doing the right thing. They happen to, so everyone on that board haven't necessarily been out there infectious with symptoms. We're just highlighting some key messages that we don't want to see, because at that point you get symptoms, it's preventable. The point before that, when you don't realise you have symptoms, of course people will turn up in various localities. But again, minimise your exposure to others at this critical time.
Dr. Chant, do we need to get to zero community transmission to get out of this? We can't live with Delta. We're not vaccinated. Do we need to get to zero? And also, I would also like to ask, will you release the health advice that you've been providing to the Premier before and during the lockdown as well?
So I think I've actually given my health advice publicly. So what I've relayed at each of the press conferences is the rationale and the assessment of what I've done. As I said, the assessment was that we needed this lockdown. We had tried everything, and when, as quickly as, once we got a sense that we'd missed some unrecognised chains, we acted to try and lock down as little as a number of people as we could, with still a massive impact, and then and immediately the next day, when we were clear that there was spread outside though, and that containment strategy was not going to work, moved to lockdown. There is at no point I don't understand the impact of a lockdown. I think from the get-go on the journey, I've certainly talked to you about my understanding of the importance of the impacts on young people, casualised workers, and people's mental health. We have tried to learn about how we can give people outdoor exercise, outdoor recreation, in order to mitigate some of those impacts. And look, the vast majority of people are doing the right thing. And I don't think anyone is really blatantly not doing the right thing. I think we do have to, through the media, get the clear messages. There's also a little bit of confusion about what, if you're a close contact, can do versus a stay at home. So if public health has told you you are a close contact of a case, what that means is you cannot leave the house. The only time you could leave the house is if you absolutely needed urgent medical care. You'd need to ring ahead, get that medical care, and wear a mask and go by ambulance or go safely. What we're wanting, that's a very different level for close contacts than the stay at home. But for the stay at home, we're permitting you to go out, but really we're asking you to apply the best common sense. At the moment, if I could see the least possible people out and about over the next 10 days in any indoor settings, I would be very happy, because that's the way we get handle on this virus for the more broad people that our contact tracing can't reach.
And zero community transmission.
So I think I've been clear in the advice, and the Premier has sort of stated it repeatedly, that our vision is that we have to have about 80% of my vision is that we need to have 80% of the population, the adult population, offered vaccination, and then we have a discussion about what the new world looks like. At some point, we have to accept that there will be community transmission. There will be at some point outbreaks, but the difficulty, particularly with the Delta virus, to control, it's proving quite challenging. And I think I would have preferred to have seen, the reason why I recommended an extension to the lockdown was that we would have expected to see, I think I mentioned it in previous press conferences, the case numbers to decline, a higher proportion of people infectious, and the fact that we've still got a large number of people infectious in the community means that we still haven't effectively stopped those chains of transmission.
There's been another example of a gentleman who's in hotel quarantine. Anthony McCormack is his name. His parent has unfortunately died while he was waiting to get into Queensland. I thought this issue had been dealt with. What's happened with that gentleman?
Look, I don't have the details of that case, but can I just say New South Wales has always done its best to cater for these situations, and my condolences to him and his family at this difficult time. I think we have to understand that this has been one of the most challenging times for us, and I really also understand and feel the sense of fatigue in the community. I think it's realistic that we're all a bit fatigued after 18 months, but vaccines are coming shortly. very effective vaccines that protect us against hospitalisation and death. And therefore, my clear advice is we need to avail ourselves of those vaccines before we have the discussion of sustained community transmission.
Minister Hazard, can we ask Minister Hazard a question, please? Minister, just going back on the comments that you made yesterday, that in the event that people aren't listening to the warnings from Dr. Kerry Chant, then we might have to accept that the Delta variant is in the community. The Premier seems to have watered down those comments today. Do you stick by what you said yesterday?
Yeah, but in the context, as Dr. Chant has said and as I've said, I think we've had more than 500 press conferences in the last 18 months while we've all had to suffer this pandemic. It all has to be in context, and the context clearly is that we would like to have more vaccines, and we have to try and achieve getting that vaccine into people's arms. But that's our focus, and that's where we should be focused.
Mike McGowan says he's considering a permanent hard border with New South Wales if you don't crush the virus itself or the Delta variant. What would be your response to him?
I guess the first thing I'd say is when we've already asked the question, you had an answer from the Premier, that would be sufficient. But if you want me to answer it, then I'd say I agree with the Premier. Sorry, Alex, just James first and I'll come to you, okay?
It sounds like Dr. Chant effectively wants no community transmission, which is what we've wanted for the whole time, right? But we're in lockdown now. We're not going to get vaccinated until October. Do you think that we'll be in lockdown until we reach a state of zero community transmission?
There's a reason why we have advice, not just daily, but almost minutely from Dr. Chant. I think we were here last night, Dr. Chant, I was here till about 9 or 10. She was here till close to midnight. We were on the phone again, this morning at about 6:30. We get advice all day, every day, James, and we come out here and we try and share the message. Could I just make very clear, the message for our community at the moment is, I know we are tired of a year and a half's pandemic. I know we're tired of the pressures on our community. I know we're tired of lockdowns, but it really is so critical at the moment that we in Greater Sydney understand that we really must not leave our homes except for essential reasons. And one person, if you've got a caring or compassionate reason, one person please, one person. And if you can do it outside the home, do it in the fresh air where we know it's safer. On that note, I thank you, but we're off. Thank you very much. Oh, sorry, Alex, sorry.
It is further on what James has said. Surely the public's going to be more compliant with what you're asking them to do. If they know exactly what it is you're trying to achieve, if there are going to be community cases of transmission, you're not going to lift the lockdown.
But we are clearly trying to achieve stopping the transmission through the community. And we're asking our community, particularly in the areas that Dr. Chant has highlighted, to really think very carefully about whether or not it's really essential, whether it's critical that you leave your home at the present time. We've done it before. I know it's really getting very tiring for us all, but we can do it again, and that's our big aim at the moment, and we'll continue to do that. And I think that's the message that we'd really like to just make sure we're there. We care about every single person in the New South Wales community. The Greater Sydney community is the area that is currently at risk. We're just asking people to think about how do you keep your family, your friends and your community safe. If you don't really need to leave your house, please don't do that. Just don't do it. And we'll see how we go over the next week and a half. Thank you.